To begin the sterile dressing change procedure, first, start by reviewing your institution's policy and procedure. Then, verify the patient's identity with two independent identifiers, such as having the patient state her name and confirming to the medical bracelet. Perform hand hygiene with an antimicrobial hand scrub or hand washing, assuring hands are allowed to completely dry. Next, don non-sterile gloves. Begin to assemble supplies. Take care to maintain sterility of supplies when opening packages. For infection prevention, be sure to wear a mask. Position patient to allow adequate visualization and access to the insertion site. Review dressing label for date. Apply clean underdrape below the patient's arm. Move gown or clothing away from insertion site to reduce risk of contamination when dressing is removed. Now, it's important to change your gloves and repeat hand hygiene. And don gloves. To ease dressing removal, alcohol pads may be used to loosen adhesive. Loosen dressing edges and then work from the proximal edge of the dressing, peeling back towards the insertion site. Applying slight pressure at the insertion site can help stabilize the catheter while the adhesive is loosened and removed. If an antimicrobial patch has been in use, remove it as a unit with the transparent film dressing. Next, remove the stabilization device. Alcohol can be used to release the adhesive for easier removal. Unsnap the stabilization device from the catheter, assuring that the catheter is held in place during stabilization device removal. If the patient cannot fully cooperate for the procedure, the catheter can be secured with a small piece of tape or a steri-strip over the extension set tubing. Don't forget to look at the catheter and assess for changes in external catheter length. Refer to insertion documentation regarding external catheter length. Discard used supplies in appropriate containers. Change your gloves. Repeat hand hygiene. And don sterile gloves. Use care when donning sterile gloves to not inadvertently cause contamination. Next, clean the skin using back and forth scrubbing motion for 30 seconds and let solution dry completely. If using an antimicrobial disc dressing, align the dressing slit in line or just off-center of the catheter. Apply a skin barrier solution. Skin barrier should dry completely and not be tacky to the touch. Reapply the stabilization device according to manufacturer's instructions for use. Then, apply a transparent semi-permeable membrane dressing. Align the center of the dressing to the insertion site, having adequate dressing borders on all edges. Assure all edges are secured well to the skin. Complete dressing by applying the extension leg strip for final tape. Prepare the needle-free connector per manufacturer's instructions. Prior to removing the existing needle-free connector, cleanse the junction and then clamp extension tubing and remove the needle-free connector. Take care to not let the open extension end come in contact with items, and then scrub the extension tubing hub with alcohol wipe for at least 15 seconds. Apply new needle-free connector with attached saline syringe, and flush the catheter per your facility policy and procedure, utilizing the manufacturer-recommended push-pause flushing technique. If the catheter will not be immediately used for infusion, be sure to clamp the extension leg to reduce risk of blood reflux or air emboli. Once you're finished, discard used supplies in appropriate containers. Remove gloves. Perform hand hygiene. And remember to label the dressing with the date, utilizing the provided dressing label. Document the procedure in the patient's medical record, taking note of insertion site, catheter external position, any remarkable signs and symptoms of complications, and how the patient tolerated the procedure.